Niyonsenga Rachel is a nurse at Gikondo Health Center in Kichichiro district who works in the outpatient department where there's a high risk of getting infected with COVID-19 due to the high influx of people. She's among those that were vaccinated against COVID-19, and she says this has protected her from being critically ill after contracting the virus for the second time. I didn't become critically ill this time because I was fully vaccinated. I believe the vaccines have protected me as opposed to how it has affected others, or the ones that I see coming to the health center. They usually have severe symptoms, and I've never had these symptoms. I went into isolation to avoid spreading the virus to others. The Rwanda Biomedical Center calls upon people to not become complacent with the preventive measures because it is possible to contract the virus multiple times.
Research shows that a person can get reinfected with COVID-19, perhaps after 2 or 3 weeks. It's possible to get reinfected multiple times. Among the recorded cases, we have people that have been infected between 1 to 3 times.
Currently, more than 10,000 people have the virus across the country and are under the home-based care program, equivalent to 98% of all who have COVID-19 currently. Officials from RBC call upon these people to not further spread the virus to other people.
When someone tests positive and feels like they aren't very sick, they should go home and isolate, where we follow up on them from. Currently, the recommended timeline is 10 days. Once those are done, we encourage them to go retest at a health center to ascertain if the virus isn't in their system anymore. There are some people that don't adhere to these guidelines, who increase the risk of infecting others. Our wish is to properly follow up on someone until they are completely fine without them infecting others.
According to the Rwanda Biomedical Center, one of the reasons for the continued rise in the number of COVID-19 cases is the Omicron variant that is highly transmissible.
When a large number of people get infected, even those that are severely ill will increase. If among every 13 cases, 1 is critically ill, that means if you have 1,000 people who test positive, you will have more severe cases. I would like to call upon each and every one that hasn't been vaccinated yet, receive their second shot or booster dose, is that vaccines are the weapon we have to help us overcome this virus. I encourage everyone to get vaccinated for their own good.
RBC notes that a person who just recovered from COVID-19 is eligible for the vaccine after 30 days. In order to better care given to COVID-19 patients required to be admitted in hospital, all district hospitals across the country have put in place between 15 to 20 special beds designated to COVID-19 patients. Reporting for RTV News, Gloria Mutesi.